Hi everyone, welcome to today's session. Okay, so before I start today's discussion, I just wanna talk about why I stopped updating my videos for such a long time. Yeah, I really apologize for that, but I'm really busy about my academic schedule. After the education of my high school, I start my summer school of the my college, and I start my first quarter of the freshman year of my college. But anyway, I am in winter vacation now, so unfortunately, I got plenty of time to continue my video record, and today we're going to start a new session of the nutrition related topics. In this session, we will utilize a new textbook, and I will share the textbook in at the end of the discussion. Okay, so first, what is the topic of today's discussion? Yoga for diabetes and chronic disease. So when we talk about the exercise, we everyone should realize that exercise is very important for physical health as well as nutrition. So when we talk about exercise, when we talk about physical health, we always combine sports and healthy diets together. So it can enhance our physical health a lot with appropriate physical activity and healthy dietary habits. But when we talk about exercise, a lot of people, including me, will first immediately think that aerobics, such as running, swimming, or the muscle strengthening uh, practices such as lifting. However, today we're going to talk about yoga. Even though it is a very popular exercise around the world, a lot of people do not practice it and do not know about it. However, yoga has a really, really deep relationship between with the nutrition and the physical health of human bodies. Except the yoga, we will talk about the effect of yoga on nutrition related chronic diseases such as the diabetes type 2 and obesity. Okay, so let's start it. So first we are going to talk about some nutrition related chronic disease, and there are some real data here. However, even though the data is between 2009 to 2010, which is very early, but it can tell us something. Okay, so let's see. Between 2009 and 2010, it is greater than one third adults. Approximately 78 million people were obese. And when we talk about obesity, we consider BMI is greater than or equal to 30 kg per m square. And if you do not know how to read the BMI, there is a table on the right. Um, if we are 30 to 34.9 kg per meter square, we consider it is obesity class 1, and we have a class 2 and extreme obesity, which is a very, very huge weight. Okay, so even though 10 more years earlier we got the huge number of the population who have the obesity, but how about now? It will be definitely greater. And except the adults, we have nearly one out of five youths, considering 2 to 19 years old age, were obese, which is BMI is greater than or equal to 95th percentile, which means that it is equal to or greater than 95% of the weight of the use. All right, so next data in 2011, greater than 52% adults 80 years old or more did not meet a recommendation for aerobic exercise or physical activity. And 76% did not meet recommendations for muscle strengthening, such as lifting, physical activity. So, and according to this data, we can really tell that there is a huge number of population who have the obesity, and a very important factor, a risk factor to lead this huge um, number of obesities because of the lack of the exercise, including both aerobics and muscle strengthening physical activity. More data: 1 in 4 Americans has multiple chronic conditions. Oh, sorry, I forgot to talk about chronic condition. What is the chronic disease? It just means the long-term disease. Okay, so 1 in 4 Americans has multiple, more than one chronic diseases on the on the body. Yeah, include for example, if a person have both obesity and diabetes type 2, can be considered multiple chronic conditions. In 2006, 84% of all healthcare spending was for 50% of the population who have one or more chronic medical conditions. It is a very, very huge spending. So on the other side, we can say that if we control our weight, if we decrease the number of the population of obesity and diabetes type 2, we can save a lot of money, and we can spend that money on other areas such as education, such as um, yeah, any other areas that government wants to spend, basic instruction, whatever. So cardiovascular disease, CVD, and cancer occupy nearly 48% of all deaths, and CVD usually with type 2 diabetes. Yeah, so if people have type 2 diabetes, they're more likely to develop cardiovascular disease, and half of the patients with type 2 diabetes die from CVD and stroke. All right, so this is a basic introduction of the data of the chronic disease. We can see that there are a lot of people who have the nutrition related chronic disease, including obesity and type 2 diabetes. And it really costs a lot of money and a lot of, and it really causes a lot of deaths. All right, so let's move into our yoga. Yeah, yoga research. Past investigations indicate that yoga tended to be small, uncontrolled, and non-randomized. However, studies now have explored yoga as an adjunct therapy for the management of arthritis, lower back pain, high blood pressure, CVD, respiratory disease, and stroke. So we can see that there are a lot of benefits of yoga, and be careful about that. Yoga is not the direct therapy we can use. It cannot replace by medicines. However, it can be a very, very good exercise for us to practice every day. It is good for our physical health, it is good for our mental health, and as you can see, it can um, be an adjunctive therapy for so many diseases. And let's talk about the relationship between yoga and diabetes. As we refer to type 2 diabetes. Yeah. So a study by yoga indicates that the significant improvements in blood glucose, lipid profiles, blood pressure, body weight, and oxidative stress makers. And we can really introduce a concept now, which is mindfulness. Mindfulness is a type of meditation similar to the mental practices of yoga. So it is basically a mental practice that some people will do every day. And if we relate mindfulness to nutrition, we can we can really relate it with them, and we can get a new idea, which is the mindful eating. Mindful practices focuses attention on the moment, a moment by moment presentation present with a non-judgmental awareness. It is just a basic introduction, basic description of mindfulness. What is the mindfulness? For people with type 2 diabetes, mindful eating, we just introduced this idea, which simply means pay attention on food may improve blood glucose management. So if patients with struggled under the type 2 diabetes, they really should consider focus on food while they're eating. Actually, mindful eating is like a lot of people they can do it. And I'll be honest, including me. There are a lot of people now they eat while they playing their phones, either checking the messages or chatting with their friends. However, mindful eating encourages us to only pay attention on food or eating food while talking with a friend or family who sit next to us. Okay, so mindful eating is a really really valuable method that should be applied in the real life. Early studies on yoga and meditation practices suggest that these practices positively affect the gene expression. However, the specific mechanisms is Unknown yet. Okay. However, we do predict some possible mechanisms. And first, we want to introduce that the background. The Americans are under high pressure, high stress, and these stress are not managed in a healthy way. And stress negatively impacts eating behaviors. Stress result, people favor poor food choices. For example, they will tend to pick some junk foods, trash foods, and increases motivation for food by triggering secretion of glucocorticoids. So, what is the glucocorticoids? Basically, we can see the idea here. Sorry, wait. So no, glucocorticoids is simply a hormone that can be produced by our body, and because of the existence of glucocorticoids, we people tend to favor the junk foods, and people tend to eat more food. Actually, this is really it really apply on me. I don't know anybody else, but some people, including me, when when they are under a high stress, they will tend to eat more. Actually, I'll give you an example. Take me as an example when I'm in the final week, when the final exams coming, I'm really stressful, and every time I go into the cafeteria, I eat a lot more than normal days. So this is a phenomenon that can be explained by secretion of glucocorticoids. And also, the stress can produces insulin, resource promotion of food intake, and finally resource in the obesity. Fortunately, yoga fosters recovery from stress and downstream effects by alleviating activation and reactivity of the hypothalamic pituitary adrenal axis and sympathadrenal system. So really, I really need to practice yoga at the next time when I feel really really stressful. And I just wanna explain the two concepts. First, what is the hypothalamic pituitary adrenal axis? So it is the communication system between three organs. It manage our stress, and these three organs hypothalamus, pituitary gland, and adrenal glands. Yeah, and if you wanna read more descriptions here, feel free to pause the video. Also, we mentioned the sympathadrenal system here, and it is also a system in our brain, and it is a system that can activate and discharge chemical messengers as a single unit to active an organism's fight or flight responses. Okay, so this is more about the neurological concepts, but if you want to read more descriptions here, it is all shown in this slide. And let's move to next slide. Okay. So, stress biases cognition toward descent executive function and increase the emotional activity in the amygdala of the brain. So, this will trigger emotional or habitual choices rather than recent cognitive decision making. So, this just explains why a lot of people, when they face stress, they tend to eat junk foods such as hamburger, fried chickens. I eat they're delicious, and yeah, just eat them. But what is the science behind this behavior? It is because of the stress can can bias the cognition toward lessen executive function and increase the emotional activity. All right. So stress can also stimulate the vagus nerve with a deep diaphragmatic breathing that includes a lengthened exhale, improve vagal tone, slightly ele- elevating heart rate on an inhale and decrease heart rate on exhale. And this behavior can increase the heart rate variability. And the heart rate variability is the measure of the variation in time between heartbeats measured in milliseconds. And there's an example here if you want to see. Also, the vagal nerves, the vagal system, carry signals between your brain, heart, and digestive system. Yeah, so it is also a very important nerve in the nutrition field. All right, and yoga practice shifts the autonomic nervous system from sympathetic fight or flight toward a parasympathetic rest and recovery activation, providing a mind body feedback loop for recovery from physiological stress. Yeah, and basically, this is all about today's discussion. Yoga is a safe and inexpensive practice that can be adapted for individuals of all ages and the physical abilities, and maybe an effective adjunctive therapy for the adoption and maintenance of healthful lifestyles. There are a lot of evidences that suggest that yoga can manage complex lifestyle derived chronic diseases, including type 2 diabetes and cardiovascular diseases. So, in today's discussion, we first talk about a lot of data about the chronic disease. We should strongly realize that obesity and diabetes type 2 are very serious problem in today's society. Now, there are a lot of people who have struggled under this problem. Then we will bring out the idea of the yoga, and we can say that yoga. What is the relationship between yoga and nutrition? Why we talk about nutrition, we need to bring out the yoga. So this is the question that you guys can consider if you want to pause the video first. And then the answer is actually that um, we will tend to eat more foods. We will tend to pick the junk foods when we face under pressure. Yes, I know that some people tend to not eat any food under the stress, but there are a lot of people who tend to eat poor foods under the stress, and the yoga can alleviate the stress. So this is why when we face the stress, we can practice yoga and maintain a both healthy physical and mental life. Okay, so this is basically what we talk about in today's discussion. If you have any questions or if you wanna discuss with me anything about the nutrition, welcome to leave your comments under the video. Thank you very much. Have a good day.